family medicine residents aren't routinely using the ACE questionnaire in clinic visits, an assessment tool that should be used when assessing trauma in childhood that continues to affect individuals as adults. Our residents were unaware of ACE screening and had no experience counseling patients with positive ACE screens. We designed and implemented an educational series based on what was done previously in my residency program to promote the importance and methods of conducting ACE screenings and resident counseling. We then gathered data on the occurrence of ACE screenings, the number of positive screens, and evidence of resident follow-up counseling with positive screens. The methods we used were we delivered a resident lecture series on ACE screenings and physician counseling to patients appropriate for follow-up physician counseling. We devised a self-report log that was available at our 2 clinic sites for 8 weeks of screening counts to be updated by residents after screenings prior to staffing the patient. Completed ACE screenings and forms were collected to track the total number of positive screenings consistently from December through February. Tracked follow-up visits after a positive ACE questionnaire by using screening dates and tracking the patients with positive ACE screenings who did have at least one follow-up visit for counseling due to positive ACE questionnaire. The results as stated showed that 50% of positive screenings resulted in at least one follow-up visit that generated a clinic visit. Of note, one positive screening generated 5 clinic visits for one particular resident. The conclusions, again, are summarized here. My entrepreneurial mindset of curiosity was achieved by exploring how to incorporate adverse childhood experience screenings into clinical practice. I thought to enhance character strengths of judgment and perspective. I wanted to give resident physicians more confidence to administer screenings, assess how and when to screen, what to do in the initial visit with a positive ACE screening, what to say to the patient, and how to make a follow-up plan for counseling. I wanted to establish the workflow and provide the education to the residency program to be able to screen and intervene patients using the ACE questionnaire. Through this course and capstone project, I was able to use my main character strengths of humility, appreciation of beauty and excellence, and perseverance to work on areas of leadership, prudence, and bravery.